Good morning. You're tuned to Tennessee Mornings on Fox 17 and News Radio 1510 WLAC. We have news, weather, traffic, plus entertainment and more.
Welcome back. It is 7:24, time for Face Facts with Dr. Deb Sherman. You know, after a long, hard week, you wake up in the morning, you look in the mirror, and you say to yourself, why do I look so tired all the time? You see those large bags around your eyes. You ask yourself, where did these bags come from? And how do I get rid of them?
Well, Dr. Deb Sherman is back, our eye and plastic surgeon and chief physician for the Sherman Aesthetic Surgery Center. And her plastic surgery nurse, Lynn Matthews, is here. And we're going to talk about these things that really frighten people when they look in the mirror in the morning. Now, let's talk about those bags around your eyes, under your eyes. What are those things that are occurring? What's happening to your face when those show up?
Well, you know, there's several different types of bags, and every person, we tell our patients, needs an individual analysis so that we can find out the treatment for their individual needs. But the most common type of bag are little fat pockets that are always there, but when you're young, you have that firm, youthful skin that holds it in place, kind of like a good corset.
And what's happening is just the shadows.
Well, with time, that fat pocket shifts from the back seat to the front seat. And that little pooch all of a sudden says, I'm tired, I'm stressed.
Oh, yes, I see what you
And
mean.
we women, as well as men, actually hate those bags.
Well, and we're talking about the ones that are not only underneath the eyes, but you also get the ones that are up top.
Absolutely. So those little pouches are quite bothersome because the first place you look at someone is their eyes.
Right, and this lady does look a little bit tired. So what can you do about that? Because, you know, I think everybody looks at themselves, and especially if you haven't had a really good night's sleep, you see them, they're very prominent.
Absolutely.
So what can be done about that, Lynn? What do you do when you have the bags? How do you get them packed?
Well, what you do is, first of all, you make sure that you go to a competent surgeon for that. And the main thing is when you look at your eyes and they're tired, and the bags around the area, you think, now what can I do about it? And a lot of people, and we love plastic surgeons, and we have a high respect for them, they go from the head to the toe. Ocular plastics, which are eye plastic surgeons, they focus right on the eyes. The very first place that everybody looks at us is right here.
Right, exactly. Well, and it's scary because you're talking about your eyes.
Absolutely.
And you only have one set, so you want to make sure you get
Well, you've
it
been
done
doing this
right.
19 years, right?
19 years.
So, are more and more people having their eyes worked on, those, especially those little bags?
Because that's the first place people see.
Right.
That shows our soul, our character. That's what we want to enhance.
Now, Dr. Deb, you know as well as I do, everybody wants everything to look natural. They don't want anything looking odd.
Right.
You know, especially if you just work on one area. Like it goes back to that facial analysis to see what all might be needed.
It does.
But can you concentrate on just that section right through there and not make it stand out to where
Well,
it
let's
looks like
look
it
at
has
some before
something?
and afters to show the difference.
All right, let's do that.
We perform this through a hidden incision.
Okay.
And the hidden incision is a little secret so that you can go behind the lower lid. And you can see that in the slide on the left as well as the slide on the right. And not only women, but also men.
Yes.
And, you know, this gentleman was a counselor, and all of his patients kept coming in saying, you look tired, do you need counseling?
Okay, hold on. Let's hold that picture for a minute. The reason I want to do that is how do you know, can you look in the mirror yourself and sort of qualify yourself as a candidate before you have your facial analysis?
Well, certainly. If you see the little pouches that are making you look tired and you see sort of a rounded pouch, you can know that you can lose that bag.
If they're constant, is that what you're saying?
Exactly. And let's go to the next one, which will show you that we can come from behind the lower lid and hide the incisions in the creases so that only your hairdresser and your doctor will know exactly what happened.
Okay.
Well, you know, this makes a big difference because people are very worried about, am I going to have a scar? Is it going to be very visual when people know that I've had this done? You know, can you tell afterward? And those before and after pictures, that look very natural.
Yeah.
Very
Well, you
natural.
see she had pouches around both her upper and her lower. You see they were quite prominent.
Yeah.
So when she looks in the mirror, she knows it's time to do something. And look at her after. You can't see an incision. They're gone.
Beautiful.
Well, Lynn, we talk about, you know, Kelly was talking about, hey, your eyes, you know, being around your eyes. You're not actually going near the eyeball itself. You're just around the lids, right?
Right. You're going for those pockets,
The outer
those
edges.
little fat pockets
Okay.
underneath.
Yeah.
And the beauty of it is you get that rested look. But most
That's the
important,
key.
you want to look like yourself.
Yes,
still.
I mean, these people don't look plastic, and that's the
No,
most important
it's
part.
relaxed.
I love that.
Dr. Deb, can you tell us what's involved in a facial analysis? Because I know you guys are offering that now. What's the process?
Absolutely. Well, because no two wrinkles are alike and no two faces are alike,
Sure.
you really need an expert with the highest level of training to analyze the eyes. So when you come in, we hear your concerns, and then we look at the proportion, we look at the excess skin, we look at the fat pockets, we look at the texture, we look at the pigment, the color. Basically, as a medical artist, we figure out how can we frame that picture called your eyes. And then we talk to you about the different treatments that are available that suits your pocketbook as well as your schedule.
There you go.
I love that.
Medical technology is
Free facial
astounding.
analysis right now, next 30 days
Sure.
at the Sherman Aesthetic Center. And here's the information, so write it down, everybody. You can give them a call this morning if you would like. It's 297-5798 next to St. Thomas. Thank you both so much for coming
Thank
in.
you.
Yeah.
It's great to see you. We love having you here every Wednesday. Make sure you're tuned in.
Feel
And
better about
next
yourself.
week, we are going to learn some of Dr. Deb's secrets at how the stars maintain that natural and ageless look with the help of some plastic surgery.
Yeah.
All of Hollywood's bags will be unpacked next week.
Oh, really? Is that
So
what we're
stay
gonna do?
tuned. Yes,
That'll
this
be
is
fun.
good stuff. I
Have
love
a great
it.
day, ladies.
Love
Good
it.
to see you. 7:29 coming up. The excitement is building, and somebody will start the day off with a big winner.